Every single day, we see changes in people's lives from the changes we make to their smile. From teeth whitening to bonding of teeth, these changes can have dramatic impacts on people's lives. People with spaces between their teeth, we can close those spaces with Invisalign, and we can bond white filling material between those teeth, and it completely changes their personality and has a tremendous impact on their life. As a general dentist, we perform most aspects of general dentistry. We perform fillings, white tooth-colored fillings, crowns, partials, extractions, root canals, Invisalign treatment, cleanings, both periodontal and regular cleanings. We perform small gum surgical procedures, dentures, both full dentures and partial dentures, pretty much the full comprehensive care.
As Dr. Dyer's office manager, I have seen lives transformed because of dental care. They have come in with smiles that they were unhappy with, and Dr. Dyer transformed their smile to a brighter smile, a prettier smile.
As a dentist, I know that a smile is very important. This has been consistently verified in countless studies showing the importance of a smile, from igniting romance to promotions at work to job interviews. People know consistently how important the smile is. We had a patient the other day that came in that we completely performed a smile makeover on. She stood up and almost started crying. She could not believe the impact that her front teeth were, how that was going to change her life. One of my favorite topics in dentistry to discuss is a technology that we have here in the office called CAD/CAM dentistry. When we use the wand to create an image of the tooth using same-day dentistry, same-day teeth, we then create the crown on the computer. I personally control the height, the shape, the contour of the crown. And then from then, we then send that computer image to the mill. The mill will then mill the crown in about 15 minutes. And then we put the crown in the patient's mouth.
Over the last 25 years, I have seen a lot of changes in dentistry. People would come to the office scared of dentistry because of previous treatments that they received. And now there is no pain in dentistry. It has come a long way to be comfortable for patients and make them feel at ease.
Every day we have patients either come to the office, call the office, and are wanting dental treatment done, but they have a fear of being in the chair, fear of getting the dental work done, even a fear of the cost. We want the visit to our office to be the patient's something they look forward to, be one of the most relaxing parts of their day. We have several things that can really help keep a patient comfortable. One of the most popular things that people use in our practice is laughing gas or nitrous oxide. People come in, they sit back, we get them relaxed on the nitrous. They don't care what we do to them. They say, "Doc, don't get in a hurry. Take your time. I'm yours for the afternoon." The happiest patients I have ever had are the patients that have had loose, floppy dentures. These patients have suffered for years with these dentures. What we do with these is that we have the implants placed and then we restore the dentures to lock them into the implants. So by doing that, the dentures are no longer moving around. Patients can eat, function in their daily lives, and they lead a remarkable life. Invisalign is a therapy that's almost specifically designed for adults. Patients that wore braces when they were, say, kids or teenagers, oftentimes they'll see those lower teeth start to shift a little. What Invisalign does then is moves the teeth back to a more normal position. Now the patients have straight teeth, which are easier to clean, better gum health, and a better bite. Sometimes patients can be born without teeth. We had a patient that was born without one of their front teeth. For years, this person had to wear a retainer that had a tooth on the front of it. When they got to be of age, we've had a single unit implant placed, and it completely changed their life. They smile now. They reported just having a better social life, doing better in school. Patient absolutely loved their implant. Patients can have implants placed from their teen years, well into their late adult life. So there really is not a person who's too old for an implant. This patient, who is in her 80s, wanted a dental implant to be able to chew and smile and function just as well as a person in their 40s. Just because you're 80 doesn't mean you can't have an implant put in. We created the Dyer dental plan for patients that currently want to have dental work done, but they currently have no insurance coverage. So patients now can get the dental work that they need without having to worry about whether or not their insurance is going to cover it, because the selling component to our plan is that patients receive a 25% discount on all of their dental services. Our practice has the benefit of being located near a major Army base, Fort Knox. We have been fortunate over the years to be able to get to know many military families. We thank them for their service, and we are one of the few that are a proud participate with all military insurance plans.
We know people don't like coming to the dentist, but we sincerely try to make them as comfortable as possible, make them feel welcome in our office. It's a family environment.
I love going to the dentist. He's my favorite person in the world. He's my dad.
I never knew, once I started dental school, how much I was going to enjoy dentistry. Every day we come in and we get to use incredible technology to change lives permanently. We change lives from small details of, correcting chips or cracks in teeth, to changing smiles where we can change the contours or the shapes of front teeth, to really full mouth reconstructions that completely change the way that patients function in their daily lives.
If someone is walking around and they don't like their smile because of their teeth, we can change that for them. We have all the technology that's necessary to make you have a beautiful smile.
A smile is very important. For instance, you have two twins, same credentials, same background. One smiles, one doesn't. Who's going to get the job? The person who smiles more. The person who smiles more is more approachable, healthier, more youthful. Those are the kinds of people that people want working for them. There are people in our town right now that walk around every day that other people think are serious, not friendly, when in reality, they just simply don't like their smile. Gentlemen wear large mustaches. People keep their head down. We can change that. Small incremental changes to their smile can make a huge difference in their life.